Hi Patricia, how are you this afternoon, or this evening I should say?
I'm good, thank you.
Excellent.
Yes.
So for our second training session, we're going to be doing a bit of a practical and implementing the assertive behaviour we were talking about, especially in your workplace settings. Sometimes you have to be assertive and say, listen, no,
Okay.
I'm sorry, I can't do that.
Yeah.
Or no, you're just going to have to wait a minute. So we're going to do a scenario this afternoon is where you're going to have a bit of a confrontation with an RN.
All right.
Your RN's going to come in and she wants you to do a task
Right.
that's outside of your scope of practice.
Oh, okay.
What are you going to do? Are you using your assertive behaviour, your body language,
You have
your
to.
eye
You have
contact?
to say no. You know.
Yeah, well,
Okay.
we're going to do that
Yes.
in a simulated scenario,
Right.
okay, and we're going to use your assertive behaviour,
Okay.
okay, and then we'll have a bit of a chat after that. So are you ready for this one?
Yeah.
Yes?
Yeah.
Okay, if you'd like to do the scenario for me, thank you, helper.
Hi Patricia, I need you to take this medication and water to Mrs. Davis in room 32 and give it to her, please.
I'm sorry, I can't do that, Nurse Hayden.
Why can't you do that?
It's not my responsibility to do it.
That someone has to do it. Why isn't it your responsibility?
I'm only a care worker. I'm not allowed to do it.
Well, someone needs to give this and I'm not happy. I'm out of here.
Okay.
Excellent. Okay, so we're going to have a bit of a chat about that scenario. Now, you're going to find that in aged care. You are going to find a nurse
Yes.
or other care workers actually who will try to bully you into doing a task. You actually handled that quite well. It can be quite intimidating, especially when you have someone higher in the hierarchy than you are,
Yes.
demanding you to do a task. Now, I'm going to ask you a little bit, we're going to elaborate on that. So why would you refuse to do such a task?
It's not up to me. It's not my job.
It's not that it's not your job. There's a better phrase you can use when you're discussing this. Do you remember what it is?
It's not my responsibility.
Scope of practice.
Scope of practice.
Scope of practice.
Okay.
So when you're in your healthcare setting,
Yes.
you've got your carers, your enrolled nurses, and your registered nurses.
Right.
They all have their own scope of practice.
Okay.
So you've got your care workers can't do what ENs do, and
No.
ENs can't do everything that RNs do.
Right.
You've got your own levels of responsibility.
Yeah.
Now, can I just ask you another question? Say you were an enrolled nurse
Yes.
and you're able to give medications. Would you accept to do that task? No. Do you
No.
know why?
It's not an Ian's responsibility. To do
ENs
that.
most certainly can give
Oh,
medications.
right.
They certainly can. But what's
Okay.
dangerous about that scenario is how do you know that what he had in his cup
Oh,
is
right.
the right medication for that particular
I
patient
see.
at that
Yes.
particular time?
Right.
Never give medication you have not prepared yourself, because you can't check the expiry date. You can't check to see if it's the right medication to start with,
Right.
if it's for that patient, because you could end up giving poor Mrs. Davis here psych medication that's not meant for her. And then whoever was supposed to get that medication could end up getting, say, a statin, which is a heart tablet.
Oh,
Prism, it can be very dangerous.
right. Yes.
So that's where assertiveness also comes to play here.
Okay.
Sorry, I can't do that because that's medication I haven't prepared. I don't know what it is. A trained pharmacist would be able to tell you exactly what it is just by looking at them.
Right.
But we're not pharmacists.
No, we're not. Okay.
So very important to say no, because sorry to ramble on, but say you're an EN, you did that task, you signed for those medications. It's your name, your signature. If they're
Yes.
wrong, it's going to fall on you. It's not going to fall on your RN.
Okay.
You could say, oh, but such and such asked me to do it. Should have said no.
Okay.
Assertiveness is so important, especially in the healthcare
Yes.
setting.
Right.
So now for our next task,
Yes.
because that happened, what do you think you need to do? What's your responsibility as a care worker having been confronted with that task?
You have to tell somebody.
Who would you tell?
One of the supervisors?
Absolutely, it definitely has to be reported.
Yes.
Definitely.
Okay.
So we're going to bring you're going to seek out your supervisor and you're going to report it.
Okay. We're seeking out. Excuse
Do
well, we've got to come into.
Yes.
Okay. Nurse Hayden just asked me to give somebody their medication. It's not my job. It's not my scope of practice
Yes.
to do that.
Yes. And that was your reply to the other
Yes,
reps
I
and
told
that?
him I couldn't do it because it's not up to me to do.
Okay, that was very good of you to do that. You should never give medication that you haven't prepared yourself or that you're not qualified for.
Mm-hmm.
I'm going to follow this up with the person that was trying to get you to take that medication, and we're going to have a discussion and report that and make sure it doesn't happen again.
Okay. Thank you.
No worries.
Yeah.
Excellent, thank you. Now, when we're talking about reporting, why do you think it's important to let your supervisor know what happened?
Because it shouldn't happen.
Absolutely, it shouldn't happen. But let's just say you've got the same nurse
Mm-hmm.
who's now going around to every other care worker asking them to do the same thing.
No, that's not right.
No, it's not, but it happens.
Yeah.
So it's important for you to let your supervisor know so your supervisor can take care of it for a start
Yes.
and can hopefully prevent it from happening again, but or can also, he'll probably go now and seek out that nurse straight
Yes.
away.
Yes.
Straight away.
Mm-hmm.
Before they can come across a care worker who isn't assertive and will give it to prevent that whole situation from happening.
Yes,
Soon as an
right.
incident happens like this, you should always report it
Yes.
because it could prevent the unthinkable.
Okay.
So well done with that reporting.
Okay.
And you will find that 90% of the time your supervisors in an aged care setting are always approachable
Yes.
because they know whatever happens in their establishment, regardless of who does it, it's going to fall straight back on them.
Ah, right.
They're
Yes.
the boss.
Yeah.
You'll take your end of the fall. They're going to take the other end of the fall, and they don't want to do that.
No.
So the more you tell him, the more informed your supervisor is,
Yes.
the better the establishment could run.
Okay.
So that's another reason why being assertive is so important, because yes, you've said no, but then you could start thinking to yourself, oh, if I report it, that nurse will know it was me. And then what if they think badly about me?
Yeah.
You can't think about that. You need to be your assertive self
Yeah.
to protect your residents.
Okay.
It's not about
Yeah.
protecting a snooty nurse. So
Right.
do you see how we could
Yeah.
implement that in the healthcare setting?
Yes.
Excellent. Oh, well, thank you very much for
Thank
your time this afternoon, and I'm going to leave you to practice that.
Okay.
Bear with me. And okay, so you can do some more of your modules, and I will print them out so you
Yes.
can look at the rest of those.
Okay. Thank you.
Excellent. Thank you so much. So hello again, Patricia. I just wanted to finish off our training session by just having a quick discussion. I might come around the other side. I apologise.
Sure. That's all right.
About how you felt that simulated scenario went.
Yeah, it was very helpful. Yes, I'm glad we did it.
Yeah, it does come as a bit of a shock. Just these things actually happen
Yes.
especially in residential facility care. Not a lot of people would be so placid to walk away like that. A lot of RNs wouldn't leave until they pretty much got what they wanted.
Oh, right.
It's very important to be aware of such things so we can certainly practice our assertive behaviours, and because you don't want to be doing a task that could put your patients at risk
No.
as well as
Okay.
your job at risk.
Yeah.
So again, that's why reporting to your supervisor is really important,
Yes.
so they can go seek them out straight away and put them back into line pretty much.
Yeah. Right.
So how do you think, if you were at work now in the residential facility and you were approached by an RN in such a way, how do you think you would handle it? Do you feel more confident now?
Oh, definitely. Yeah. Gives me a good idea of what to do. how to approach that sort of situation.
Yeah,
Yeah.
sure. And so you're happy with what you've learnt? Is
Yes.
there any other questions that you have for me?
No, I'm pretty happy with that.
Excellent.
Thank you.
Yeah, you're welcome. Well, thank you for your time, and I'll check in with you shortly.
Okay, thank you.
Thank you.